Okay, when the patient come to my office, I have to make a diagnosis of dementia. Then we can start off the treatment later. And usually when they come with their spouse, the spouse always complain, you say, oh, Dr. Chang, something wrong with my husband. He is not right. Check him out. I would say, what's wrong with him? And then, the wife said, he is very forgetful. He can't even remember, the kid's name. So that really light up something. We have to be very careful about that. We need to get a good history, from the spouse or from the patient himself, and just see what kind of problem they have. And the next test I would do is do a short-term memory test. That's a very useful, but it's a very simple test. I usually would, give out 3 items, such as an orange, a pencil, or name a car, and ask them to remember that and test them in about 5 minutes. Some patients can reproduce all 3 items without any problems, but some patients might end up with 0 answer, so that is very alarming. If the patient cannot answer any one of the 3, it's very high chance they already got dementia. The next test I would normally do is ask them to do a little bit of drawing. The most favorite test I would like to do is ask the patient to draw a little watch and tell them, what time you expect them to draw. Such as the one on the right side, I ask my patient to draw a clock with 11 o'clock. As you can see, he did do a little circle there, but it's not 100% perfect. But he did a circle, but unfortunately, the 2 arms of the clock are pointing in correct position. So by doing this test, actually we can test a few things, on the patient. Number 1, we test whether the patient can listen to the instructions, whether he can understand your instruction drawing a clock. Okay. Number 2 is you're testing his hand drawing skill, whether he can draw a clock, his handwriting, whether it's good or not. Okay. Number 3, you can test whether the patient understands what you mean by 11 o'clock. Okay. So a lot of things actually, just by asking this simple test, you can test on the patients. And then, we have more tests already used, for years and years, such as MMSE, that involve a lot of questions in the test, at least 18 to 20 questions. And then the 6 CIT is a more simple test. You ask simple questions such as what time is it now? What day is today? Where you are, those are the tests, you test for dementia too. Okay. So after all this, detailed history of the patient and the simple test, you already can judge whether the patient have dementia by 70 to 80%. And then you order some image studies such as CT scan or MRI or PET scan. The function of those tests are, you want to test whether the patient have a brain tumor, right? We talk about that. Some people have reversible dementia. If it is a brain tumor, you can go for a surgery, and then you remove the brain tumor there, and hopefully the patient have better mental function after that. And of course, another test you need to do is a blood test. You want to check for the thyroid functions, make sure they have adequate secretion of the thyroxine from the thyroid. You want to check for a vitamin B, make sure they don't have B12 deficiency. And you want to check for the kidney function, liver function, because sometimes that affects their mental function as well. So those are the basic things you need to do before you jump into the diagnosis of dementia.
Thank you so much, Dr. Chang, for sharing this valuable information on the topic of dementia, and also giving us some secret tips to prevent dementia as well. If you like this video, please share and like, and most importantly, subscribe our channel.